chlorhexidine into the CSF of a patient. This is one of the secrets that I have never revealed, that one of my SR had given chlorhexidine into the CSF of a patient by mistaking it to be a bupivacaine, because he was doing an ultrasound guided block, fascia iliaca block, before the procedure, and he had loaded chlorhex in one of the syringes to visualize the image by the ultrasound probe, and later on he gave it in place of bupivacaine, and the patient had seizure on table. However, he managed it well. He first managed it by securing the airway, taking care of the breathing and circulation. Because for the seizures, he gave anti-epileptic, and because now the patient was intubated, he first made the patient in head up position so that minimal drug gets into the CNS, and then in lateral position, he chose one level where he inserted 20 gauge spinal needle and started aspirating CSF first. So because it was chlorhex, he knew that a lot of CSF lavage had to be done. So he actually aspirated 50 ml of the CSF and then injected 50 ml of normal saline at the same space. He also told me later that a double needle technique could be done, where a lower space can be used for aspirating the CSF, and a higher space, 2 to 3 spaces above or even above, you can inject these normal saline from the higher side, so that the normal saline will push the drug below and it prevents CNS spread. So this is one thing. He For chlorhexidine, he did it for 3 times: 50 ml aspirate, 50 ml injection of the normal saline, and 50 ml again aspirate and injection. Later on, when the patient was spontaneously breathing, he was free of seizures in the post-op ICU. He was extubated after 6 to 8 hours, and everything was perfectly fine. After 3 to 4 days, he was discharged, and there was no sequel, even though it was one of the most dreadful thing that you have injected chlorhex in the CSF, but it was managed properly. So comment below if you ever had faced a wrong drug injection into the CSF space and have managed it by CSF lavage.